Well, good
Okay.
morning. My name is Allison Anthony, and I'm the president and CEO of the Tulsa Area United Way. And if there was ever an example of great timing in the world, it would be that we had scheduled for this month our normal monthly agency tour with Mental Health Association of Oklahoma. And our great friend and partner in so many things, Mike Bros, who's the Chief Empowerment Officer at Mental Health Association Oklahoma. And it's just such a obviously timely topic, but I want to just give you this as much as I can, the same experience as you would get on a monthly agency tour. So I want you to know that the mission of the Tulsa Area United Way is to unite people and resources to improve lives and strengthen communities. And one of the ways we do that is making sure that all of our donors and all of our volunteers and our company partners and our nonprofit partners all have access and the ability to learn about the other agencies among our 59 partner agencies. And you all, many of you are familiar with our fundraising campaign in the fall, but we also, while we raise those funds, we also have a very, very strenuous and rigorous process of ensuring the strength and outcomes and oversight and governance of our 59 partner agencies. And few are stronger in any of those categories of their effectiveness than the Mental Health Association Oklahoma. So what we like to do is lift up those agencies during our monthly agency tour and have the ability for you to interact and get to know, as if you're a donor, you're an investor in this organization. And so it's a way for you to learn more about this organization. So I will just a little bit of housekeeping. You have access to the chat tool. You have access to the Q&A tool. But we would like for you, as much as possible, because we can record them differently, if you wouldn't mind submitting your questions to the Q&A tool, then we will, at the end, when Mike's finished giving his presentation, we'll use that Q&A tool to pull some questions and try to get as many of your questions answered if possible. So, you know, Mike and I were just talking before the call that, and he's going to share a little bit more, but you know, just this morning on my way into the office, I was listening to NPR, and I think it was Morning Edition, and they were speaking about the increase in suicide calls. And we have some astounding statistics coming in from our Community Service Council. And Mike, you may be going into some detail about these indicators, but one that I know is that in February, our 211 Community Service Council in February had under 500 calls related to mental health and mental health concerns, needs, episodes. And by the end of March, in the month of March, had more than 2,500. So, you know, just a huge increase in the number of people reaching out and saying, I need help. So we are so excited to have one of the nation's leading experts in most knowledgeable and most effective, in my mind, in the area of mental health. And Mike's been there since 1993, so you'd think he'd seen just about everything, but he has not seen a pandemic yet. So we wanted to give you every experience, Mike, in the world in your, you know, many years of leading. So now you've pretty much seen it all. You have led this state, Mike, personally, I just want to say, to a higher understanding across the state about our brains and brain health, and the fact that our mental health is our health. And you have really helped us recognize our shared humanity in this state, and helping us break down stigma and turn instead with compassion toward those who need our help. And then I always like to say, we all need help sometimes, and my own family is no exception. So Mike, let's start with an overview of the Mental Health Association of Oklahoma, and then we'll move into COVID-19's impact on your work, the association's work, what you see as the short and long-term implications in the mental health arena, and then finally truly, we welcome any advice you have as we continue to navigate the unknown and seek tools and resources to help us cope. So thank you for being here, Mike, and I'll turn it over to you.
Well, thank you, Allison, so much. This has been, as you said, I have seen a lot of things in my career. I've been practicing here in Oklahoma as a social worker for 40 years, and then in my current position for the past 27 years as the head of the Mental Health Association Oklahoma. And this is unprecedented. I've never seen anything like this, and I'm learning every day right along with all of us together. And I'm coping, and I'll get into that a little bit later about, my own mental health right now. I'm no different than anybody else, contrary to sometimes myth that mental health professionals have it together. We're just like everybody else. We have to take care of ourselves and do that well and be able to help others. Again, I'd like to thank the Tulsa Area United Way for giving us this opportunity. I wish we were all at the physical location and I was taking you around and showing you things that we're doing. We'll hopefully get to do that another time, but I'm so thankful for the Tulsa United Way to host this. This is a very important time. Now more than ever do we need our United Way, more than ever. So just a little bit of overview about Mental Health Association Oklahoma. We have been in existence since 1955. Somewhere in there, we're not real sure. The documents, the United Way probably has better records on this but from what we can tell, since about 58, we became a member of around 58 members of the old community chest, which is now the United Way, Tulsa Area United Way. So we've been a partner member agency for many, many years, and we are so proud of that. And it's something that we cherish and think that we do everything we can to support the United Way and be an active participant with our own fundraising, by the way, that we do every year. And we'll be going into our campaign very soon. We are at our core. We do a lot of different things that I'll talk about, but I want your viewers, listeners to keep in mind, we are a mental health advocacy, mental health education organization. Sometimes people think of us, these are technical terms and I don't want to get too deep into them, but there's a difference between what in our industry, what's called a mental health provider, and like us, a mental health education, mental health advocacy. We deliver all kinds of services, which I'll talk about. But for example, Family and Children's Services, that's a member agency of Tulsa United Way. They are a mental health provider. We work very closely with them, and of course, many other mental health providers in the community and state to help people get the services that they need. We interface with 211. Allison talked about those numbers. We've had communication with 211. We know that 211 has been asked, particularly early on, but even now, people need very concrete services. And sometimes people call 211, obviously at a very frequent rate right now, where they're calling 211 and they have mental health care needs. And we've worked out an agreement with 211 that when their staff on the phones get bogged down and people begin to ask very complex mental health related problems, that they can refer those over to us. And that happens all the time to what we call our Mental Health Assistance Center. And our Mental Health Assistance Center is really a portal of entry. Anybody you know or love, or friends, neighbors, people you worship with, co-workers, I would like to tell you that the mental health care system was easy to navigate. It's not. We're working every day with our partners to try to help them be more user-friendly. But the healthcare system, the physical healthcare system, the mental healthcare system, typically sometimes are hard for some people, particularly our most vulnerable, to navigate those systems. Mental Health Assistance Center that the United Way supports, where we have a staff member on staff every day, answering phones, answering calls, communicating with people by text and email, helping them to navigate. So it's like a one-stop shop. You don't know where to go. You're not sure what's going on with you or a friend or a loved one, a coworker. You need some guidance and help because you want to try to go to the right place and get that zeroed in. So we at our mental health assistance center, we do an assessment. Like I say, most of the time that's over the phone, and sometimes it's face-to-face. And we sort of do an assessment, trying to figure out, listen, ask questions, figure out exactly what's going on with this family or this individual, and then help them navigate that system to get the services that they need. That's a big deal. It doesn't cost anything. And we go to great lengths to let the individuals know that they can call back as many times as they need to until they're satisfied that they've got the services that they need. And that's really important because sometimes you refer people places, and if it doesn't work, people think, well, what do I do now? And we make a big deal about call us back. Well, that's okay. We're going to stick right by you until you get the services they need. It's a big thing. Okay. So Mental Health Assistance Center is one of the things we do. We're involved with children. We do a lot of children's behavioral health. We have a staff member who is funded actually by the state of Oklahoma. Again, we get funding from different sources. About approximately 3 to 4% of our overall funding comes from the Tulsa Area United Way, which those dollars help leverage a lot of the things I'm going to talk about, where we've been able to go out and apply and leverage other contracts, grants, state contracts, federal grants, all that, but it's the United Way dollars that are the linchpin funding that makes that possible. But we do a lot of things with children's behavioral health in a very coordinated, collaborative way. Again, we're a major convener of lots of behavioral health that serve children who come together to work with us. As a matter of fact, let's see, I think they met yesterday. That group were on virtually, continuing to have their meetings in this particular venue in over this similar medium. So we're very involved with children's behavioral health. Of course, Teen Screen, we go into schools. Again, right now, schools are out, but we'll start up hopefully in the fall again. We'll do screening where we go into schools and we screen for young people, particularly adolescents, having suicidal thoughts, dealing with substance abuse issues, depression, severe anxiety, and then we use a very, very well documented, researched online tool that's done with the computer and the young person with parental permission. And then they get on, respond to the issues, and then they, in turn, if they score what we call score positive, we contact the parent, let the parent know, and then help the parent get to a provider. Again, back to a provider of mental health care services for young people to get a full assessment to find out exactly what's going on with that young person. That's a big deal because we know that our adolescents, a lot of times, they talk to their friends, but they don't always talk to us as parents. And a lot of times, some people have referred to the adolescent mind as the black box. What is exactly going on in our adolescent's mind? Well, the Teen Screen is very, very well researched and really able to really get at that information, and that is screened by a licensed mental health professionals that do that screening. So we're in different schools, moving around all across the community and across the area, and have been doing that for many years. We're also very involved in, some of you may know, of housing. And we know that if people don't have a place to live, they can't get services very easy, and it's very difficult. So the Mental Health Association is a leader in the nation in the development and the operations of affordable housing. We have actually about 1,500 units scattered around 23 different apartment buildings in 17 different neighborhoods. You drive by our apartments every day, and if we were out there today doing this in real time, you'd be able to see that. And you'd say, wow, people, this happens all the time. They'll say, I drive by here all the time. I never knew this was anything. Well, that's because we're good neighbors, and our units are what we call mixed use. So we have just affordable market rate units for low income individuals in our community. Anybody can rent one of our market rate apartments. I can rent one if I wanted to do that, needed to do that. And then we have what we call program housing. Excuse me. And so the program housing is where those are units that are tied to various different types of grants, providing housing for veterans that have been homeless, providing housing for young adults 18 to 24 who have a mental illness and who are homeless. It's also individuals who are just in the community. Many of them, not all of them, but many of them have been histories of living on the streets in our shelters, and we've moved them into housing. COVID-19 has slowed us a little bit, but we're still housing people. I may get into that a little more, and you may have some questions about that, but we are still housing individuals. So we have about 1,500 units around the community, and those are very, very important for allowing people to have a place to live. Because people have a place to live, then it's much easier then to help them get connected to services, and sometimes the services actually come to their door if needed by the Mental Health Association, as well as our different community partners that we work with, again, providers in many cases. Excuse me. Housing is a big deal. Now, once we found out, when we got into housing, we really discovered that people loved, we found that people, again, there's kind of a myth. We're always battling these myths. One is that people, you may have heard, these people, they like to be homeless. That's not true. They hate being homeless. They can't figure out how to they don't have the resources to be able to get out of that. So we have our homeless outreach teams. With COVID-19, we've kind of had to slow that. I'll talk about that a little bit, but we're still out there doing outreach to our homeless, working with our shelter partners, reaching people in encampments, on the streets, responding, working very closely with law enforcement. We work very closely with law enforcement on that, trying to divert people out of homelessness into affordable housing, and we do that every day. So the other thing we found, again, there's another myth. Excuse me, I'm going to get a drink of water here. The other thing is that we found that one of the myths is that people who are homeless don't want to work. That's not true. We have found over and over again that people who move into a place to live and they get stabilized, they know where their next meal is coming from. They don't have to worry about that now. They know where they're going to be sleeping tonight. They're going to be safe, and they don't have to worry about that now. And suddenly they start thinking about taking better care of themselves, getting involved with their mental health care, their physical well-being, dental care. We always talk about dental care. It's a very overlooked, sometimes very important thing, for people to be able to get the services that they need. And then lo and behold, people really are interested. Many of them who can and are able, they're interested in employment opportunities. And we've really grown in our employment opportunities, working with people and supported employment, helping them get connected. We walk the walk as we talk the talk. We've done repeated surveys with our staff, blind, anonymous surveys with our staff to ask them a few questions about themselves. We discovered, which we kind of knew, but we actually have data now to back that up, about half of our approximately 185 employees, about half of them have histories of living in recovery. And we say recovery, we're talking about a history of mental illness, sometimes a history of substance abuse, a history of homelessness, and histories of incarceration. And we have many employees that check all four of those boxes or more than one. And so about half of our employees are actually people themselves living in recovery. So we've hired them, folks, and giving them an opportunity to become self-sustainable. And now we've moved out into the community, working with employers, finding employers. Some of you may be listening, watching, and say, hey, I'd like to maybe participate with that, please contact us, and we will get you fixed up and work with you to help you know how to employ people, giving that opportunity of self-sustainability. There's nothing greater that aids a person's mental health than having a chance to be employed and have a job. It's an amazing thing. Most of us on this call, on this webinar right now, we have that in our lives. But we also know that right now with COVID-19, many people who have taken employment for granted suddenly are not employed, and have been laid off or furloughed in some way, and as related to the economic impact of COVID-19. And now we all have a better grasp and understanding how much of our identity, our mental health, our self-esteem, our well-being, our sense of who we are, and then being able to provide financially for ourselves and our families, what a big deal that is, and the impact on our brains, on our mental health. So that's a big deal. Employment, we have a number of different programs, including our barista training program, where we train people how to be baristas. We have people out there getting connected with all kinds of jobs. Of course, our Better Way, we were trying to do a modified version of that during COVID-19, where we pick up and invite people who are out panhandling to come on to the van and go out and work, do an honest day's work for an honest day's pay, getting them connected up with other needs, housing, mental health care, physical health care, other sort of issues that are going on with them. And Better Way is a big deal. And that's a big partnership that we have with the city of Tulsa, which we're very grateful for them, and United Way also helps with that. So, these things you start to see them together now. You start to see, housing, employment, sustainability, prevention. We're big on prevention. We're big on mental health education. We do a lot of a big event, our Zero Symposium, every fall to educate our mental health professionals, bringing in the best in the country, around the world, actually, bringing them in here to Tulsa and to provide our mental health professionals all across the state of Oklahoma, but especially here in the Tulsa area, the top line learning, education, information, the latest in research and intervention on that. So we're very involved in that also. So that kind of gives you a little bit of an overview. There's more to what we do. I could go on quite a while. We're a big convener. When we see something in the communities not working well, in the systemic piece, we're a convener, bringing everybody around the table. Okay, what are we going to do? We're very involved in criminal justice reform, helping people, non-violent offenders, not violent offenders, I'm talking about non-violent offenders, get out of incarceration, get reconnected. They still have accountability to the legal system, but getting them reconnected with housing, employment, mental health care, substance abuse treatment, if that's what they need. And so they can figure out how to not be in a situation where they need to turn back to reoffending in some ways and become self-sustainable. So it's a big, big deal. I want to just real quickly, that's a very, very brief overview that you may have more questions about our services that we provide. There are many more that I could talk about, but those give you at least an overview of that. But I want to just really quickly mention about COVID-19, like your businesses, my businesses. I'm thankful for Payroll Protection Plan. We've applied for that and received that funding to help us. We have not laid anybody off. People have asked us, when are you going to reopen? We've never closed. We've modified how we do it. I actually did a national webinar on creating new business models in a COVID-19 world. So we really challenged our teams, and we said, hey, here's the safety parameters that we're giving you. How is it that you can continue to deliver your services and still practice safely? And those teams came back to us as management and began to present. We began to dialogue, and I'll give you a couple of examples. One of the first things I thought, oh no, our support groups, our anxiety support group, our survivors of suicide support group, our depression support group, our supporting parent support group, oh my gosh, we're gonna have to shut them down. We did temporarily for 1 week. The next week we were back up virtually, and which has been very interesting, because many, many more people have been able to get on, not just from Tulsa Metro. We actually were looking at data yesterday. We actually had people on our support groups from New York, not many, but a couple. And from around the region and area, the primary people served are people local. So we got our regular support groups back up and running. And then we said, okay, we got those stabilized. Let's have some special COVID-19 support groups. And we have a COVID-19 support group for first responders. We have one for people who are out there working. I always when I have to go to the grocery store, I thank those people that are working to help keep that food supply going, and they're out there in harm's way. So we're really, really trying to provide for them and the support they need. And then just for a third COVID-19 support group, just for the general population. We've all been impacted. And I'll talk about that just a little bit more to close. But we want to really continue to do that. And so we've been able to do that. Our homeless outreach team, they have masks on. We're like everybody else early on, getting personal protection equipment. We've been able to secure enough N95 masks and gloves right now. We're out there using physical distancing rules and protocols, but we're continuing to do homeless outreach in the community, getting people into housing, continuing to do that. We have a lot of concerns about our 24/7 properties. We have 3 different 24/7 where we're staffed 24/7 in our housing properties, trying to make sure that staff and residents are safe. So far, so good. We know it could change any minute, but we're doing everything we can to mitigate that, and continuing to be in communication with our partners to deliver services. And I say our partners, and many of those partners are other Tulsa Area United Way member programs. So we're still operating. We're still doing all the work we do. We've had to just change a few things. Our drop-in centers we had to close them temporarily, both here in Oklahoma City. We've had to, but we're starting to we're developing plans to reopen those. We've been working very skillfully in a very remote, using virtual remote, just like we're doing this right now, this webinar, and it's been very successful. We've all adapted. Alice and I were talking right before the call how we just all had to learn to do this, and we've become very adept, and I'm sure you are where you're at in your business, many of you also. Again, but we do have staff out in what I call out in harm's way, and we're doing everything we can to give them the training, the tools, the equipment that they need, and the information they need so they can continue to serve people and do it safely. And the numbers and the data, which we don't have time to go into, are amazing. I'm just so proud of our staff. We have 2 times a month now, we're doing it to keep everybody connected at an all staff meeting. And if any of you guys would like to ever listen in, we have one this Friday. We'd be happy to send you a link and let you listen in. Everything we try to do is transparent, where we have over 100 people on there. We have different designated speakers get on and talk about the things that they're doing. If any of you would like to listen in to our all-staff meeting this Friday, let me know, and we'll get you connected up, because we're totally open about that. I want to just mention a few things here in closing about some of the data. And again, in the early parts of the pandemic, of course, we continue to be very concerned about physical well-being, about protecting ourselves, mitigating spread. And we've been very cognizant all the way through that we're not just protecting ourselves from being infected, we're trying to protect the people we serve from being infected by us, because we all know by now, hopefully everybody knows, that you can be asymptomatic and not have any symptoms at all, but be spreading the virus, which is one of the, not only is it highly contagious, that particular factor really contributes to the continued spread that we're all trying to mitigate. Several things have come out. I want to thank my friends over at Healthy Minds. They've done some very initial sort of analysis. They have projections that more people in Oklahoma will die from behavioral health issues. We know COVID-19, but behavioral health issues. Allison mentioned earlier about the report out of NPR that the increase in the suicide rate. We've anticipated that. You know, people, again, many of the viewers here, I always never fail. I want to always mention this, is that very few people know that there we have in our country 3 times as many suicides as we do homicides every year. And that's been true for many, many years. And we have about 46,000 people die every year from suicide in compared to about 18,000 homicides. So we'd like to reduce the homicide number, but we particularly would like to reduce the suicide number. Again, one of our programs that we do, QPR, Question, Persuade, Refer. It's a 1-hour training for you can do it in a business. We can do it in a faith community. We can do it in a school for staff, and we can do it online now. And we're doing it virtually. We started our trainings back on doing it on virtual, and being able to provide the training to give people, lay people, the tools, just like CPR. It's a play on words, just like CPR, QPR, Question, Persuade, Refer, in a 1-hour training that doesn't cost anything other than an hour's time. It's an evidence-based practice to teach people, lay people, how to be able to do that. And so if you're interested, contact the Mental Health Association, and we'll be happy to schedule for you and your business a online training for QPR, teaching your employees how to ask a question and how to save a life. We also know that you know, substance abuse is going to continue to be an issue. It's an issue every day. And when I say substance abuse, what I include, I'm talking about alcohol. It's legal. We know that amphetamine use, methamphetamine is continuing to be a very big problem here in Oklahoma. It creates all kinds of havoc on families. People get involved in incarceration, legal systems related to that. They get separated from their family and children. So we want to do a shout out to Women in Recovery. One of our big partners has done amazing things there. Our partners over at 12 and 12, who have been great partners with us in working together to get people the services that they need. We know that childhood mental health is going to increase. I mean, we know that parenting issues, young parents are, you know, stuck at home. The kids are stuck at home. It's unnatural. We're not used to that. Particularly adolescents are used to being more mobile. Young children have huge needs when they're home. Parents are trying to do their work. Or they have childcare problems. It's very big. And again, that's something we understand that has a great impact on people's mental health. And we can help with that through our Mental Health Assistance Center if needed. Unemployment. We know that if you, like you said, I said earlier, if you lose your job, you're unemployed, you've been laid off or furloughed, it will affect your mental health very severely. And people have anxiety. There increased levels of depression. And again, a lot of times people will try to cope in appropriate ways. Alcohol, other substances, prescribed and unprescribed. A lot of times we run into people all the time. They're taking prescribed medication, particularly benzodiazepines. That's Xanax is one of those. It's not the only one, but it's one of those you hear a lot about. And people say, oh, well, my doctor prescribed it. And now I'm taking my Xanax, and now I'm having a couple of 3 glasses of wine at night. That's a bad combination, and it creates a lot of problems. If you're in that situation, know someone, reach out to us. We'll help you get to what you need to do. So I'm talking about, now you've heard all about universal precautions, washing your hands, physical distancing, wearing a mask, all the things that we talk about, universal precautions. I like to talk about also, in addition to that, universal mental health precautions. What is that? You ask. Well, those are very basic things that we need to be doing all the time anyway. You need to be getting the rest that we need. People are reported over and over again, this new way of working is exhausting. And they're working not only during the day, they're working at night. You need to take a break. You need to take breaks during the day. You need to, try to get your rest. Also, what else? Guess what? Physical exercise. People say, well, I can't. I don't have my health club's closed. No, there's ways to do that at home. There's a lot of online things. I know one of the things we're providing to our employees right now every Monday afternoon at 4 o'clock, we took our yoga class and now we just went virtual with it. So we have employees get on there and they do practice yoga as a part of their physical and mental health practices, what have you. Good nutrition. We really need to work on our nutrition and eat healthy. I struggle with sugar intake all the time. I have to really watch it. I was talking to myself this morning about that. Again, reach out if you know someone who is isolated and alone. I kind of divide people into 3 categories. There's those that are working virtual and we're at home and we struggle with isolation. We know isolation too much. I like to say physical distancing instead of social distancing. We need more social connection. Yes, physical distancing, but we need to use these different mediums: phone, text, call, virtual, Zoom, to be more physically connected. We have to be very, very diligent about that. I know we had a party. A virtual party we had a whole bunch of people on there a week ago Saturday night. We did it at 9 o'clock, no work, just having fun, playing, listening to music, calling each other while we're looking at each other and waving and carrying on. We just needed to relax a little bit. So those are good things. I just want to, again, so nutrition, rest, get your rest, and exercise, take breaks, all those sort of things. Exercise, hey, one of the things that's relatively safe. Taking a walk through the neighborhood. There's no better exercise than taking a walk. My son and I took a long 3-mile walk yesterday. It felt great. If you can't do anything, you need to get out of the house and you're isolated, get in the car and drive around. When the weather's nice, roll the window down, drive around town. Just to get some different scenery, do some things. Sometimes mental health prevention, universal mental health precautions are very, very practical things to do. So, I think that's the lion's share of I wanted to cover. Again, I wanted to just remind that, just because there's those of us that are sheltering, and then those that have to go to work and go into harm's way. That's a whole different set of stressors. And then, of course, those that are unemployed. So you got kind of those 3 categories, and they all affect our mental health. So we want to be real careful about them. So I'll close now, and I'll open it up to Q&A. And Allison, I'll turn it back over to you. Obviously, there's a lot to talk about here.
There is so much to talk about, Mike, and you did a remarkable job working in a lot in a short amount of time. So really appreciate it. I wanted to share with the folks on the line, there's more than 100 people on this call, that you really were one of the first out of the gate to walk the talk and to lead the rest of the nonprofit community, frankly, in an understanding of how to move online and how to go virtually and remotely. And you were one of the first to send your folks into a remote work environment. So the first question is, talk a little bit about 2 things: your decision-making as a leader, and why you, after being there since 93, why you're the chief empowerment officer and not the chief executive officer, and how that all plays into your decision-making during this time of crisis.
Yeah, I love that. I get a lot of comments about I'm the CEO, I'm the Chief Empowerment Officer, and I never liked the Chief Executive Officer. I always liked being the Executive Director. That was my title for many, many years. I still kind of miss that, but they said, well, you're big now, you got to be a CEO, blah, blah, blah. So there's a long story behind it. If anybody ever wants to talk to me, I can tell you the whole story. It's a lovely, lovely story about a young man who gave me the idea, and then I went online. But it really, what I liked about it really reflects how I try to manage, is empower my staff. And I think a lot of people, a lot of leaders out there, if they really think about it, that's how they work. And I also like to be humble. My attempt to be humble. If they say, if you think you're humble, you're not being humble. But I try to really be have the recognition that I'm not all that smart, and the best way to manage is get the best minds that you can get around a particular problem, and that's how I manage. And I want to do a shout out to my senior executive team at Mental Health Association Oklahoma, because I got some fabulous people around me, and who I delegate to, and I let them do what they do, and I become a resource for them. And we try to really talk entrepreneurship, and that's how we've grown our organization, by being entrepreneurs with all these different programs programs and areas of the organization. So, but we also were blessed. We have a fantastic IT department, and Michael Huber and his team, to shout out to them. They had us up, and so we could have the technological ability and we had the equipment in place. That really helped us. But we went right to, from the very get-go, we said our number one job right now is to protect and the safety of our workforce. So we pulled back. I always say that in military terminology, retreat is a legitimate tactic. So we didn't know about this adversary. So we pulled back, we retreated, and then we come back out in a more safe, organized way to be able to continue services. So we've been very fortunate with that. And again, I don't know, we were the first or leaders, but if we've been encouraging to anybody else, we're happy about that. But we have a tremendous team, and that's how we work. It's a team. It's not just me, it's a team. And I have a great amount of affection and appreciation for the staff that we have at the Mental Health Association.
Thanks, Mike. I love that philosophy. And we'll throw out a book because I think sometimes people think entrepreneurialism is just for small business, or if I'm starting out my own business. And I think that in particular, the nonprofit community can benefit from being very entrepreneurial. Our strategic planning is based around the book called Traction by Gino Wickman, where we're really trying to push ourselves to be very innovative. We're a nearly 100-year-old organization, so we want to keep being focused on reinvention too. So that's a great resource. Another great question that I know you have a passion talking about: is it true, Mike, that other cities bus in their homeless people to Tulsa because we have such great services here?
Oh boy, Allison, I didn't pay you to ask that question, but I'm so glad you asked it, or somebody asked it. That is a long-standing myth, and it's really funny. I mean, it's sad and funny, because I go to national conferences and I'll ask other people who are in this business in other communities. I'll say, by the way, do you guys ever hear that? And they go, oh yeah, we hear that all the time. People, oh God, they're busting here, and because we have these great services. That is an urban myth. And through the one night count, we actually have data to show. And I always like to ask people when I encounter people on the streets, talk to them, or on the streets or in our housing, I like to always ask them, so where'd you grow up? And invariably, they grew up in Oklahoma. Where'd you go to high school? I went to Hale High School. I went to Jinx High School. They're our neighbors, our friends, what have you, and they've had bad things happen to them, and they've ended up without a place to live. And I have had a standing challenge to anybody who can bring to me the name of the city and the organization that bused somebody to Tulsa for these services, to bring that to me, and I will personally contact that organization, that person, another city, and they're going to hear from me, because that ain't cool. And I just don't see it. We don't, and again, that myth is told all over the country. It is a myth, but again, it's amazing how it continues to have life and belief, and people really, really believe that. So your listeners, I'm telling you, it's a myth. Anyway.
Thank you for clearing that up. We have a question about how we, as just members in the community, can help those who are experiencing homelessness right now during this pandemic. If we know someone is experiencing homelessness, Mike, what would you advise us to do?
Yeah, well, so we've set up a number. You can call our main number and ask for our mental health assistance center, but they'll get that number to the director of our homeless outreach team, Jessica Kelly, and her team. Man, they're a bunch of my heroes in life, the work that they do and the passions they bring to it. But we'll meet people. Again, it's not 24/7. I don't want to mislead your viewers. We can't do it in the middle of the night, but we'll get to it the next morning. But we'll go out and check on someone. They'll drive all over the place, and again, we're practicing very safety measures there, what have you. We don't want to infect anybody that's not infected, and we don't want to be infected ourselves, but we'll go out there and talk to them and find out. We'll also, if we can, we'll try to call back and let the person know, give them some feedback about that individual and what's going on with them. But we know that we get those calls all the time. People worry about people. And again, I just want to say this. We don't encourage, we discourage people handing out money outside their car windows to people. That's enabling, and a lot of times, almost always, that's related to substance abuse. It's not really, and we've created that by handing money, give to the United Way that support the organizations that where we can have a lasting impact on people's lives and outreach to them for permanent solutions, not temporary. I know we all feel bad about that, and it looks bad, but that doesn't really help our cause. It actually enables and encourages that ongoing behavior of panhandling in the community, and we discourage that. And we're not alone. All of our partners, the shelters, other homeless outreach teams in the community, we're all united on that. That does not help.
Thank you, Mike. And one of the things I wanted you to share about, because I think it's such a great topic, and I'm not sure what the Zero Symposium will look like this year, but could you just share a little bit more about the Zero Symposium, the topic that it was going to, because I think it is just so very, very relevant, and then also share if people want to present or want to sign up, how that's working right now and during.
Yeah. So the Zero Symposium last year was 25th Zero Symposium. It started the year after I came, and it's grown and developed. And so it's become one of the premier, actually in the country, one of the premier mental health 2-day conferences, and with many, many local, regional expertise, talent presenting, and then national speakers and presenters being brought in, and from all over the country. Each year it's a different topic, and we try to really give a lot of thought, and what's a hot topic? What do we need to be thinking about? What do we need to be talking about in the community and state? And this year we went to the Race Massacre Commission, and we asked their permission. We wanted to do it, and now it's healing from historical trauma. And we approached the Race Massacre Commission, asked their permission if we could have that be a focus, and to partner with the commission on that this year. So we're really in the centennial of the Tulsa Race Massacre. There'll be a lot of emphasis and focus on that healing and recovery, teaching clinicians as well as people in the community how to be sensitive, aware, understand the impact of trauma and historical trauma, and how it continues to get passed down from generation to generation unless we can deal with it, and helping professionals know how to more effectively deal with it. And it's not just with while the race massacre trauma will be a big focus of that, but we're looking at we're partnering with other organizations. We're partnering with the Jewish Federation, the trauma that Jews have experienced all through their history, the Holocaust, particularly the Native American community, and the incredible amount of trauma that the Native American community has undergone historically, and how that continues to have an impact. I think you hear people say, "Oh, well, that happened a long time ago." Now, what does that have to do with now? Well, that's just not accurate. It continues to have, it passes down. And it gets handed down, and that trauma continues unless we intervene and do it collectively and individually and what have you, so healing can occur, and so we can break that cycle, that trauma, and let people begin to be healthier, to be mentally and physically healthier around those traumas, not forget about them, but try to experience the healing of it. So we've got just a whole different thing. I've actually submitted one. I haven't heard whether it's got accepted yet. I'm doing one called COVID-19, the hidden trauma, because I think we are to some degree being traumatized right now, and we don't know yet. It will continue to unfold about how that will impact us going forward. We're doing something around spiritual trauma. Sometimes, as good as faith and religion is in our lives, sometimes it can be traumatizing, and if it's done in certain ways, we're going to look at that. There's just a lot of different things that are out there, the different forms of trauma that go on. So that's the focus this year of the Zero Symposium. Oh, you can go online to sign up. you can go to our website, mhaok.org, and you can sign up there. And we would love to have you. We are looking at it. It's going to be at the Cox Business Center on October 1st and 2nd, but we're also doing a dual track. We're ready to do it virtual if necessary, but it's going on. We're going to have that conference, and we're having Dr. Cornell West back, who will be a keynote in the evening on Thursday evening. And we're so excited about having Dr. West. If you've not heard him, he will change your life. He is a true American treasure, and we're honored to have Dr. West here, who grew up in Tulsa, by the way, and is one of the leading spokesmen on racial trauma, the impact of racial trauma in our country's history, which is a very complicated history, as all of us know.
That is going to be great, and we look forward to hopefully all being together. But if we're not, I know you guys will find a way to get all that great content out.
Oh, we're going forward. Yeah, we're resilient. You got to be resilient right now.
Are resilient, and I want to come back to that. I want to make sure that people have the number to the Mental Health Assistance Center. I believe it's 918-585-1213. If that's correct, we will get that typed into the chat. Okay, Mike says that's right, 918-585-1213. And I have a question regarding that. If a group, a nonprofit on the call has clients over the age of 55, would you consider that the best way to connect if they know they have clients over 55 dealing with depression? Is that mental health assistance line a good way to start? I know also, I'll just say 211 is another resource that can help, but if they're pretty clear that they've got clients dealing with depression, what would you recommend?
Yeah, again, one of the roles of the Mental Health Assistance Center is to be able to, where do you go and what is the situation? And that's what we try to help people do, is kind of really get an assessment. And it's easy to say, and I just want to do it again right here, right now on 55 and over, a shout out to one of our partners that we actually share space with at Legacy Plaza. Senior Services is one of our key partners there, and sometimes we refer over to them, and sometimes they refer to us. Depends what's going on. But the Mental Health Assistance Center is a place where people start, so they can call, and we'd be happy to have your listener figure out kind of what's going on with this 55 over situation and get to the right place.
Okay, the questions are pouring in now. We got them rolling. So. Scott McClung's question is, have you considered a run for governor as you're retiring, as this is your last year in this particular role? We were just wondering if you would consider a run for governor. And if not,
I haven't considered it, but I can give you a quick answer. No. I don't think that's somebody else's deal, what have you. But, we are politically active now. We are advocates, and we take positions. We're for and against things, and so we're very active. After I'm transitioned out of my position, I don't know what I'm going to be doing, but I'm hoping to have some opportunities to help, and I'm not going to stop working. I got gardening over here to do, and a lot of yard work, and a lot of weeds, but they'll wait. I got things to do, and I'm going to continue to be active in the transition.
That's great, Mike. Yeah, I don't see you just sitting on the porch pulling a few weeds. I think
impossible.
Yeah, I think you've got a lot of good impact left to create in this world. Just a couple specific areas. I'm going to highlight a couple of things just to give your voice a break. You mentioned some of the ways that we partner at United Way, and I'm going to highlight those because I think it's an educational opportunity for those on the call to understand the United Way funding model. We fund Mental Health Association as a sustaining one of our 59 partner agencies annually for your operations, ways to work together. You mentioned A Better Way, which is part of our social innovation grant, where you guys said with the city of Tulsa, we have a great idea, but we need to test it out before we go out and try to get other funders to fund it. Let us try to test it. And so that annual innovation grant process is a great way that United Way and Mental Health have worked together. You also, we also work with you on some of our collaboration grants. A couple that come to mind that you all have been very involved with are Away Home for Tulsa, where 30 partners in the community really work together to, that's a collaboration grant that United Way helps,
Yep.
because it's a complex and untenable community problem that no one can solve on their own. So we fund collaboration grant work. Another one that's super cool that you guys have been involved in is a community response team, where mental health professionals go out with fire or police and now have mental health professionals on those 911 call centers to help guide some of that work. So that came about as a collaboration grant. So I just wanted to highlight to the audience that sometimes when you think about, oh, we know the United Way or we know the Mental Health Association, there's lots of ways that that we work together in this community. And I think one silver lining of this COVID pandemic is that we've learned how well we work together as a community and how collaborative, and that is wonderful that we had that foundation already. So it made it a lot easier to pivot to new ways of adapting.
Yep.
And I just will ask you a couple of other questions that have come in here. How does a person find out about and become a part of the COVID-19 support group?
Yeah, you can go on our website and get the times and dates and when that meets and what have you, and it'll give you the directions. Now, they do screen a little bit about who gets on there. So probably the best way to start would be, though, go through our Mental Health Assistance Center and talk to probably Lucinda Morty, probably. There are other people who are helping to staff that too right now, but to get on there, and they'll ask a few questions, what have you, and then they'll give you all the information. And we want people who are getting on there to be appropriate and be at the right place. And so it isn't just anybody could get on there and potentially be someone could potentially be disruptive. We don't need that, and the other participants don't need that. But so there's a little bit of screening, but you can call our Mental Health Assistance Center. Again, our Mental Health Assistance Center is kind of our portal of entry into all things mental health, as well as not only within our organization, but out in the community as well. So that'd be the best way to get on there for the virtual support group.
Okay. Mark Davis says, since you're not running for governor, you might think about mayor in the future.
We got a good mayor.
Yeah, we have a great.
We got a good. Oh, he's a good one, man. I'm so proud of our leadership. I was on a call on the press conference here a few weeks ago. You may have seen me, and with Karen Keith and with GT Bynum and with Bruce out at the Tulsa City County Health Department. And man, what leadership we've got right now, and I'm really appreciative. And we're Mental Health Association Oklahoma. We're also active in Oklahoma City, and we work closely with Mayor Holt over there too. We got two great mayors in the two metro areas in Oklahoma. We ought to be very, very appreciative of all that right now.
Oklahoma City, Mike, yeah, our mayors are doing a wonderful job, as is Dr. Dart at the public Tulsa Health Department.
Bruce Dart has been fabulous. He's consulted with us, mental health providers, a number of occasions. He's been on calls with us. He's been very responsive, and can't thank them enough over at the health department there.
You mentioned the Mental Health Assistance Center in Tulsa. We gave that number, but I want to, Krista, if you could type in the Mental Health Assistance Center number, if any are needing that out of Oklahoma City, is 405-943-3700. Thank you, Kelly, for sending that. And then I also want to just lift up, just in closing, you mentioned the first responders, those in the police and fire and on the front lines in the hospital. I think they're experiencing kind of a special kind of trauma that we've never seen before. And so I wondered if you would talk a little bit about what you're seeing and hearing out of that first responder line, and what you would recommend for people who are helping those who are the helpers.
Yeah, it's interesting because helping people, first responders, it's kind of endemic to it. It's not a good thing, but it's just the reality of it. Is sometimes those people are so geared to helping others, they're not always that good or adept at receiving help and recognizing that they need help too. And that's one of the things we're really preaching to our staff right now. And I'm trying to preach to myself, I've got to be careful about my own mental health because I'm impacted just like everybody else. But our first responders, our healthcare, our doctors, our nurses' aides, the people that are there in those hospitals, keeping the floors and clean and safe and all the things that have to go on, they're in harm's way in a very real way. Fire, police, they can't say, hey, well, we're going virtual. That doesn't work that way. They have to go out there and be in harm's way every day. Now, not just from other sort of harm, fire, or other sorts of threat, but now from a threat from an invisible, an enemy that we can't see. And so we need to make sure their families get stressed, they're stressed. And we need to make sure that they get the mental health. And let me say, the fire department, Tulsa Fire Department and Tulsa Police Department have a contract with a great mental health provider in the community that does great work. I know some of those people over there, they're fantastic. But sometimes some of those people don't want to go that route. They'd like to go another route or whatever, or it might be about their family member who doesn't want to go that direction. So that's why we wanted to do this with them. And provide this as another alternative. So we're getting some use to that. We are hoping for more, but we'll see more, I think, in time. Again, I think we're kind of battling is that helping professionals, first responders, whatever, we're really interesting. We're not that good at, we're great at giving help, helping others, but we're not that good at receiving help. And this is no time for that. We've got to recognize we're all impacted here. And if we take care of ourselves, we're better equipped to take care of others. That's the rule of the road here.
I'm reading a book about asking for help, and somebody that thought that was funny, they said, just say, I need help. And I said, for some of us, it's just not ever been that easy. So
I struggle with it. I mean, I'm like, people ask me all the time, well, Mike, how are you doing? Oh, I'm okay. And sometimes I am and sometimes I'm not. I have to work on that all the time and myself.
Well, you set a great example, and we are pretty well out of time. I want to just highlight a couple of things that I wrote down. One is the Tulsa area, both your website and our Tulsa Area United Way, tauw.org, has great resources. That's been one of the ways our team is helping the community. It has interactive food resources where you can put in your location and see where the food is if you need that help. I also want to highlight, you mentioned DVIS, domestic violence resources that we also have on our website, but also a program called Look Out, Reach Out, because some of the helpers aren't in their normal roles to help children who are suffering from abuse or neglect. And so we have to come together as a community and watch out and raise up, and there's resources on there to help people do that. Finally, the EAP programs, the employee assistance programs, are many of the EAPs in our companies have, where you can get, for example, 5 free counseling sessions.
So glad you mentioned that, Allison. I meant to mention that. That's really important.
Important. You can't think of everything, Mike. You almost got it all here. And then I'm just going to close by saying that we together have focused a lot on hope and resilience in this community. You've talked about how we adapted. I felt like I was very empowered once I got my parents on Zoom. Anything could happen. So, I think we've proven that we understand in this community the trauma informed, and we're working every day to get better about that. To not, as we practice patience and presence, to not say what's wrong with you, but to say what happened to you and how can we help. To be patient and compassionate and present, and that's what a Chief Empowerment Officer does, Mike. So I think with that, we'll close. Any last final word?
Well, I think we need to have you come over and be a good spokesman for us, Allison. I love that about you. You're not afraid to be very transparent. And just to talk about that. And I think as our United Way leader, that means a lot to many of us who recognize you're not just doing the work, you're also willing to use the services if it's necessary for your well-being, the well-being for your family. And that's great leadership, Allison. Thank you for that.
I think anybody who's not being a little bit vulnerable in this time is probably not being completely honest with themselves or anyone else. So we all need help time. It's a great way to end a United Way call. So reach out if we can help. Thank you all. Be safe.